This is a 61-year-old male who came with history of assault 7 days ago. So yagwa mu batemu ne bamukuba omukono. So he used the arm as a guard ne bagukuba. So he came with pain in the distal forearm with inability to pronate and spinate. Don't mind about the stamp on the index finger. That is an injury he sustained some time back. So bamukuba n'atekayo omukono nga yeetaasa. So yazze nga alumwa waba omukono gwagukyusa ogutunuza waggulu ne wansi nga atambuza engalo ezo ozitunuza waggulu ne wansi. But we had no neurovascular deficiencies. All the fingers were moving well and well vascularized. So we had to assess, and we did an X-ray, of course, as we are going to see it. So the X-ray revealed a spiral fracture in the distal ulna, as you can see from this picture of the X-ray. On your left is the lateral view, and on your right is the AP view. So you can appreciate in the AP view on your right the two bones, whereby the ulna is the smaller one distally and the radius is the bigger one distally. So that's how you can identify that this is the ulna, this is the radius. So it's our ulna that is having a spiral pattern of a fracture. Then when you look at the lateral view, you can still appreciate whether we have a displacement or not. Of course, after that, we have to look at the adjacent joints, that's the wrist and the elbow, whether they're okay, and also the whole length of the bones to make sure that we don't miss out anything. Then this picture is going to remind us of the different patterns of fractures. So we have two rows, the upper and the lower row. Beginning from the upper row on your left, that is a normal bone, how it's supposed to look like. The second picture is a transverse fracture. You just have a transverse line of a fracture that goes through the whole length of the bone. Then the next one is when you have a fracture piercing part of the tissues and communicates with the external environment. It can communicate visibly at the presentation of the patient, or it can communicate and go back. But so long as there is communication with the external environment, that is an open fracture. Then the next one is the oblique. You just have a fracture line that goes oblique throughout the whole circumference of the bone. Then the last one on your upper row, on your right, that is the oblique, which is displaced. Then you go to the lower row. In lower row, we have a comminuted pattern where we have more than 2 fragments. So you can see very many bone fragments. That's the comminuted fracture. Then the next one is the segmented or segmental. You have different fracture lines at different areas, but going through the whole circumference, like making segments in the bone. Then the next one is the avulsity, where you have part or a chip of a bone getting detached. It could be where a muscle inserts. The next one is the spiral pattern, where you have a line going through the whole circumference, but at different levels, like going on around the bone or through the circumference. Then the last one is the green stick fracture, where we said in the previous video that one side of the bone is fractured and the other side, okay, the fracture line is not complete through the whole circumference. So this side fractures fractures, but the other side just bends. Then these are some of the pics taken during the process of cast application. Remember, you position the limb, then of course make sure the skin is clean and dry. Then you go on applying that cotton depending on which type of cotton or which quality of cotton you have. Then after that, you go on step by step applying your POP bandage as you mold it, in a good fashion, so that it can take the shape of the limb which you want to maintain. This is after we have applied the cast, and we are instructing the patient to move the fingers to make sure that they are free and they are exercising well, because we have to stimulate and maintain that saturation to maintain the functionality of the fingers. We use this ordinary POP cast, but there are other types of casts which are a bit modern. For example, this fiberglass, which is light and classy.